Assalamu alaikum.
عليكم السلام. هلا تفضل.
My name is Hauri Ahmed, and I will present today about anatomy of stomach. The stomach is a J-shaped muscular organ or bag located between the esophagus from above and duodenum below, mainly to the left of upper abdomen, to the left of hemidiaphragm. The size and shape of stomach varies according to the volume of its contents and according with the position of the patient, whether erect or supine, and with inspiration and expiration, and from person to person, differing especially with the build of subject. The parts of stomach, the stomach has two curves, the lesser curve and the greater curve. The lesser curve has an angulation at the lower part, the incisura angularis, and also has two orifices, the cardiac orifice and the pyloric orifice. The cardiac orifice, also called radiologically gastroesophageal junction. According to the parts, we have four parts. The fundus, which is above the level of gastroesophageal junction, below the left hemidiaphragm. And from the level of gastroesophageal junction to the level of incisura angularis is the body of stomach. And from the level of incisura to the sulcus intermedius is the antrum. And the last part, we have the pyloric canal, which act as anatomical and physiological sphincter at the level of L1 lumbar vertebra, 2.5 cm to the right of midline. This is barium meal, single contrast, showing the parts of stomach. The first part, we have the fundus, and the contrast filling part is the body. And here's the lesser curve and greater curve, and here is the incisura angularis, and this is the antrum, and this is the pyloric narrowing or pyloric canal. The lining of stomach, the mucosa of stomach has a characteristic appearance. It's thrown either into folds, longitudinal folds, gastric folds, or called rugae, as shown here, number 4, along the long axis of stomach with the lesser and greater curve. And we have the nodular elevation, 2 to 3 mm nodular elevation, especially at the antral region, called area gastricae. The rugal folds or gastric folds that are parallel to the lesser curve called Magenstrasse, stomach street. The muscle layers of stomach, the stomach has 3 muscle layers, unlike the small large bowel, which is 2 muscle layer. The muscle layers, we have the outermost is the longitudinal muscle layer, and the middle layer we have the circular, and the innermost we have the longitudinal oblique layer. The circular layer extends at the pyloric region to form the pyloric sphincter, while the oblique layer gives fibers to the gastroesophageal junction to prevent reflux of stomach content into the esophagus. The peritoneal covering of stomach. The stomach is completely covered by peritoneum, anterior surface and posterior surface, and extend from the lesser curve toward the liver as the lesser omentum, and from the greater curve toward the transverse colon as the greater omentum, and from the and continue as transverse mesocolon, which connect the transverse colon to the pancreas. The relations of stomach, we have anterior relations and posterior relations. The anterior relation, upper part of stomach, is covered by left lobe of liver on its right and by left diaphragm on left. Of course, on the left, we have not just the diaphragm, we have the left costal margin, the left pleura and lung and diaphragm. The lower part or remaining part of stomach is covered by anterior abdominal wall. The posterior relations of the stomach, we have the lesser sac and the stomach bed. The structures of the stomach bed, we have the laterally gastric surfaces of spleen, left adrenal, and left kidney. We have centrally the full length of pancreas, And we have medially the aorta and celiac axis, and inferiorly the transverse mesocolon, which attaches, as we said, the transverse colon to the anterior surface of pancreas. The arterial supply of stomach, according to the regions of stomach, we have the lesser curve, which is supplied by two vessels. The arterial supply mainly from the branch of celiac trunk. So the lesser curve supplied by two vessels, by left gastric artery, which is a main branch from celiac trunk, and by right gastric artery, which is a small branch from either hepatic artery proper or from left hepatic artery. The greater curve of stomach supplied by also two vessels. We have the right gastroepiploic artery from the gastroduodenal artery, which is a branch of common hepatic artery, and we have the left gastroepiploic artery, which is branch of splenic artery. The fundus of stomach supplied by short gastric branch, which is a branch of splenic artery, and also supplies the upper part of greater curve. The arterial supply of stomach is anastomosed between each other within the wall of stomach, unlike the blood supply to the small and large bowels, which are end on arteries. This is an angiogram of celiac trunk showing the branch of celiac trunk. We have this, the number 3 is the splenic artery, which gives the short gastric vessels, and the left gastroepiploic artery, number 13. And here, this is number 4, this is the left gastric artery, main branch from the celiac trunk. And number 5 is common hepatic artery, which gives the hepatic artery proper and the gastroduodenal artery. The gastroduodenal artery gives the right gastroepiploic branch, and we have the hepatic artery proper divided into right hepatic and left hepatic, and we have the right gastric artery, small vessel, which arises from the left gastric artery, left hepatic artery. The venous drainage and lymphatics of the stomach follow the arterial supply. The right gastric and left gastric veins drain to the portal vein directly, while the short gastric and left gastroepiploic veins drain to the splenic vein. And the splenic vein, of course, drain into the portal vein. The right gastroepiploic vein drains to the superior mesenteric vein. And the left gastric vein, also known as coronary vein, receives blood from the lower third of esophagus. This is the venous drainage of stomach. We have the, at the area of lesser curve, we have the left gastric vein and the right gastric vein directly into the portal vein. We have here the short gastric veins, and the left gastroepiploic vein drain into the splenic vein, and from splenic, which continue to form the portal with the superior mesenteric vein, and the right gastroepiploic vein, which drain into the superior mesenteric vein. The lymph drainage of stomach also, as we said, follows the arterial supply. The left gastric artery lymphatics drain directly into the celiac nodes. The right gastric artery and right gastroepiploic artery lymphatics drain via the retroduodenal nodes and from there to celiac nodes, while the short gastric and left gastroepiploic lymphatics drain via the nodes in the splenic hilum and from behind the pancreas into the celiac nodes. Then the celiac nodes drain into the cisterna chyli, which continue to the chest as the thoracic duct. The innervation of stomach, we have sympathetic innervation and parasympathetic. The sympathetic is from the sympathetic chain, segments T5, T12 of the sympathetic chain via greater and lesser splanchnic nerves. The sympathetic supply causes vasoconstriction and inhibition of gastric motility and pyloric constriction, while the parasympathetic through the vagus nerve, because we have anterior vagal trunk and posterior vagal trunk. The anterior supply the anterior surface of the upper body and fundus and trunk and parts of the lesser curvature and the pylorus, while the posterior supply the cardiac orifice and posterior surface of the body and trunk. The parasympathetic supply is secretomotor to the gastric mucosa, promote gastric motility, and relaxes the pyloric sphincter during gastric emptying. عنده سؤال لحد هنا؟
اوكي، احد عنده سؤال؟ على الفيناس الليمفاتيك الارتيريال سبلاي الاستومك قبل ما ننتقل للراديولوجيكال فيتشرز. ماركو هاوري تفضل.
تمام. Now we have the radiological features of the stomach. First modality we have the plain film of abdomen. طبعا الستومك limited يعني البلين فيلم يعني limited يعني visualization of stomach. We have either erect or supine. طبعا لازم الستومك إذا fluid filled may not be seen if fluid filled or empty. لازم gas filled. طبعا in supine الغاز on the anterior wall will allow visualization of the rugae of stomach, gives the linear pattern. And in erect position, we see fluid level, white fluid level below the left hemidiaphragm in the fundus of stomach. If the stomach is distended, maybe we see two fluid levels, one in the body of stomach and one in the antrum. This is erect plain film showing the air fluid level below the left hemidiaphragm in the fundus, while the remaining parts of stomach cannot be seen. Ultrasound, second modality, also it is limited due to presence of gas, whether within the lumen of stomach or within the bowel. The main part of stomach seen by ultrasound is the antrum, طبعا. Of course, also we can see stomach bed structures if the stomach is gas-free or fluid-filled, such as the pancreas, aorta, and celiac trunk. The other part also we can see with the antrum is the gastroesophageal junction, normally be identified by their characteristic hypoechoic muscular layer surrounding echogenic mucosa. طبعا هذا هو gut signature sign. We will talk about it. The gastroesophageal junction is seen as a small rounded structure behind the top of left lobe of liver, while the antrum is more elongated and is seen behind the left lobe of liver, just to the right of midline. This is ultrasound of epigastric region showing the antrum and the pyloric canal. This is the pulp or of the duodenum showing the layers of طبعا antrum, echogenic بعدين hypoechoic بعدين echogenic. This is another image of epigastric region showing this is the round gastroesophageal junction behind the left lobe of liver. The gut signature sign is characteristic appearance of layers of stomach. طبعا هذا الgut signature مو بس على الstomach يعني حتى الesophagus, small bowel, large bowel, from inner to outer. It will give, we have the mucosa which appear echogenic. The muscularis mucosae appears hypoechoic, while the submucosa appear echogenic, and the muscularis propria hypoechoic, and the last layer is the serosa, 5 layers. طبعا هذا normally لازم نشوفه if we have pathology either cause destruction of this يسمونه layers يعني هاي gut signature sign. Another important use of ultrasound for stomach, we have the hypertrophic pyloric stenosis, especially in infants طبعا. We see the pyloric canal will be elongated more than 13, 14 millim, such as we see here, 24 millim in length. And the muscular layer will be thickened more than 3 millim. If we measure this, of course, it will be 7 or 8 millim. And the transverse diameter of the pyloric canal will be more than 12 millim. So it's very useful to diagnose hypertrophic pyloric stenosis. The other modality we use for stomach is the barium meal. طبعا عندنا single contrast barium meal and double contrast. The single contrast barium meal, we will see the configuration of stomach, such as the greater, lesser curves, incisura, cardia, fundus, body, antrum, pylorus. طبعا أي يعني position or any part suspicious, we can use the fluoroscopy. This is single contrast barium meal showing the parts such as we see before, the fundus, and here is the gastroesophageal junction. This is the body until the incisura, from here the antrum, continue, and from here the pyloric canal. The double contrast barium meal is used mainly to see the details of mucosa of stomach. As we said, we will see the area gastric as small nodular elevation, 2 to 3 mm, mainly in the antrum, and we see the rugae, 3 to 5 mm thickness, longitudinal, false. Of course, gastroparetic agents such as glucagon or buscopan will efface these patterns. We have also compression views, can only be used to the parts that behind the anterior abdominal wall, the lower part of stomach, lower body and antrum. This is double contrast barium meal showing the deep mucosal details of stomach, such as the rugae we have. And we have the mucosal elevation area gastric. CT and MRI of stomach. Really, CT and MRI not routinely used for stomach unless we have tumor, and we use CT for staging, or we use it to see the structures in the stomach bed, as we say, such as the pancreas, aorta, celiac trunk. The mucosa of stomach enhances with intravenous contrast, and the stomach layers are best appreciated in the arterial phase, 20 to 30 seconds after we give the contrast. And the wall of stomach will be, as we say, take contrast, of course, when there is no positive contrast in the stomach. The fundus of stomach may project posteriorly and mimic an adrenal mass on CT and MRI. Foods in the stomach can appear as pseudomass and is seen especially in the dependent portion. This is axial view CT scan of stomach, of course, with contrast, showing the gastroesophageal junction and the contrast within the stomach lumen. This is structures in the stomach bed, such as the pancreas, and this is the stomach here, contrast within it, and this is the aorta. This is coronal view of CT, showing the parts of stomach, the fundus, the body, and this is the incisor angularis, greater curve, and the antral region. And the last, we have the angiogram of the celiac trunk. This is digital subtraction angiogram, showing the branch of celiac trunk. We have the splenic artery here, gives the short gastric branch which supply the fundus, and the remaining branch of splenic not seen here. We have the left gastric artery which supply the lesser curve and gives branch to the lower esophageal gastroesophageal junction. And we have the common hepatic artery, which gives the gastroduodenal and the hepatic artery proper, and the hepatic artery proper divided into left hepatic and right hepatic. And we have the right gastric, either arise from the left hepatic or from the hepatic artery proper. This is CT with contrast, showing the branch of celiac trunk. This is axial view, and this is sagittal view. We have the splenic artery and the common hepatic artery. The remaining parts or branch cannot be seen. This is another view of digital subtraction angiogram, showing the parts of celiac trunk. As we said, this is the short gastric artery. This is the left gastroepiploic artery here, and this is the right gastroepiploic continuation of gastroduodenal artery, and the right left hepatic artery, this common hepatic artery, and this is the left gastric artery. This is the gives branch to the lesser curve, and this is the lower part of esophagus. And we have quiz.
إذن نختار وسام.
نعم أستاذ. The liver is an anterior relation. This statement is it true?
هو المفروض يكملها، يقول anterior relation to the stomach يعني. أوكي. نارين.
نعم أستاذ. رقم 2. It is normally supplied by superior mesenteric artery, false, by celiac trunk.
By celiac, excellent. هونر.
نعم أستاذ. رقم 3 the incisura angularis is a notch on the greater curvature. أستاذ false. It's a notch on the laser curvature.
اكسلنت. دكتور حيدر عباس. حيدر عباس
نعم
ويانا.
أستاذ. نعم أستاذ موجود.
Number-
Number 4 the left adrenal is a posterior relation to the stomach. True.
اترو. وعندنا علي. دكتور علي عبد الجليل.
نعم أستاذ. The area gastrici is clearly seen on single barrier meal. False statement on double يعني on double contrast.
اكسلنت. وعادة وين نشوف الاريا جاستريكا؟
بالأنترم أكثر شيء أستاذ.
اكثر شيء بالانترم. اكسلنت. اوكي سام محمد تفضل.
شكرا استاذ رعد. آيات خليف نمبر 1. آيات.
نعم أستاذ. Number 1 هو lesser curvature of the stomach.
lesser curvature of the stomach. دلال محمد نمبر 2.
نعم أستاذ. نمبر 2 gastric fold روقي.
gastric روقي. نعم. نمبر 3 رسل ناهض.
نعم أستاذ.
نعم.
نمبر 3 الانسيسورا انجولاريس.
انسيسورا انجولاريس. جيد. زينة فاضل نمبر 4.
أستاذ greater curvature.
greater curvature. سولين نمبر 5.
دكتور هذا هو الأنترم.
هذا هو الأنترم. وآخر شيء محمد إبراهيم نمبر 6.
نعم أستاذ. رقم 6 اريا جاستريكا.
تمام. عندك بعد سلايد لو هاي هي؟
لا لا أستاذ خلاص.